Hello, today I'm just going to discuss briefly about the recent technique of doing knee replacement surgery. This technique is called patient-specific knee instruments. It is also known by the name of custom knee replacement. Essentially, this technique involves doing a CT or an MRI scan of the knee to be operated upon. Based on these images, a three-dimensional bone model is created, which is exact replica of the bone structure of the patient. So, this is the bone model that we get once we use this technique. This matches the shape and size of the patient's bone. So this is the thigh bone and this is the top of the shin bone, and this is how the joint is supposed to be of the patient. Now, as a surgeon, if I can get this model before the operation, it helps me tremendously because I can then plan the amount of surgical steps, I can plan the amount of bone cut, I can plan the size of the implant, I can plan the fitting, the orientation in a much better way. And the best part is that all this planning is done before the operation so that I don't have to spend time during the procedure. Now, with this thing done, the companies nowadays make specific instruments which would then fit onto patient's bone. So these are the two instruments that are made specifically based on the patient's bony structure, and then these two instruments are shipped to the surgeon in a box which is then sterilized and used in the operation. So this box, for example, has my name and patient's name on it, and this box is shipped to me 3 or 4 days before the planned date of surgery. It undergoes a CT scan. So this is a pre-planned technique done by a company called Striker. A CT scan is done, and based on that CT scan, these 3D models are created. And based on these 3D models, these two jigs or cutting blocks, we can say, they are manufactured and shipped to me. So what is the advantage of this cutting block? These fit very precisely on the patient's bone because they are made to their size. And using these blocks, we can omit up to 23 surgical steps. So we don't have to do those 23 surgical steps that we would be doing otherwise. So it helps a lot in reducing the surgical time, it reduces the blood loss, and the most important part is that it improves the alignment and fitting, which is a crucial factor to the recovery of the patient. The patients who have a well-fitting implant, they will feel a lot more satisfied with their knees compared to somebody else whose implant is not that well-fitting. So this is the major advantage of this particular technique. And this particular technique has now overtaken computer navigated surgery, because in computer navigation it increases the steps of surgery, and every planning and every step of the procedure is done while we are operating. So instead of computer navigation, we nowadays do what we call as a pre-plan. Everything is planned before the operation.